Welcome back to part 2 of common or sample interview questions for nurses. Now, in today's video, I'm going to be concentrating of if you are going for interview, let's say for elderly care, home nursing home, something related to the care of the elderly. These are some of the questions you might be asked. The first could be, talk me through your experience to date. Remember those questions that people usually say, tell me about yourself? There are various ways that can be asked. And one of them is, talk me through your experience till date. This is just you or them giving you the opportunity to tell them why they should hire you. Do not miss this chance to express who you are. If I was asked these questions to be told, like to tell them about myself till date, my experience till date, this is what I will say. I will start by telling them, thank you. My name is Nduweso. I am a registered general nurse, a registered ophthalmic nurse, graduated since 2015, went ahead to do my post-basic nursing 2018, and have been working in acute care setting. And this could be in acute care setting question. It could also be in a chronic, a long-term facility session. So you want to tell them the kind of institution you're working with. Is it acute care? Is it a long-term facility? What kind of patients do you take care of? What do you do when you resume work? Have you been able to move from one position to the other? Are you currently in a higher position than when you started? How has your let's say your experience improved, your job improved, your professional skills improved during the years? Why do you think they should ask? In fact, put everything within this question. Do not joke with it. If you have undergone any, let's say, continuous professional development programs in the past that is relevant to that post you're interviewing for, please do not forget to mention it during this question. Next question you might be asked is, how would you demonstrate these good communication skills? Now, when they said good communication skills, initially when I resumed work in this country, I really did not understand what that means. It is during my practice that I understand that communication skills is slightly different from you being able to speak in English. Now, let me give you a typical example. You go into a unit and you are currently working in a particular ward. You have like 2-3 patients you're taking care of, and you have to go on leave for, let's say, 12 o'clock. Then something happened with your patient and you were not able to meet up with your time for break. It is your responsibility to let someone know that this is what happened. I am not able to go for my break at this time. Please, I would love to finish this. Is it okay if I finish this before I go for my break? Or can I go for my break and then after I come back? You need to let someone know. That's part of communication skills. Or you attend to a service user, because you remember we kind of talking about long-term facility and they're being known as service users or residents. You are attending to a particular patient and something happened. You need to state what happened to someone. You do not just suck it up and then let it go, because this thing is something that might come up in the nearest future against or for you, something in that aspect. So if they ask you, how are you going to show good communication skills, state a scenario that needed you to escalate something. You took a patient's vital signs and you see that the parameters are out of place, either they are low or high, or it's not meeting the targets depending on the condition of that patient. You need to escalate, and that escalation is part of your communication skills. And when you are escalating, you want to tell somebody, whoever you're escalating to, in a way that the person understands, as if the person is there. You do not just call somebody and say, my patient is having blood pressure of 250/100. No, there is a way you communicate. Here they have what they call the ISBAR tool, ISBAR. If you browse that online, you will see it. But literally what it means is ISBAR is identification, the situation, B is the background, and A is what, and then B is report, something like that. So there is a format for you to communicate. Hello, introducing yourself. This is Ndoeso calling from St. Luke's ward. Am I on to so person? Oh, okay, I'm taking care of this patient. There's a patient name. Patient was admitted so days ago and is on management for so condition. I am just taking the blood pressure and it's over this and this. And according to the escalation protocol, I decided to let you know. So you want to, even since you're not yet practicing in Ireland, for you to say, okay, you want to use the ISBAR tool, because if you say that, it may sound like you're just quoting something. We still do something like that back home, but not just called ISBAR. Remember, if you are caring for a patient back home, you need to call the doctor. You need to call either the junior age or the senior age or the consultant or whoever is in the ward. You need to call the managing team. It is the same thing. That is how you demonstrate good communication skills. I hope you understand. If you've watched up to this point, my name is Ndoeso. I am a registered nurse, and this is all I do, making videos like this, telling you how you can migrate to Ireland or any country of your choice as a nurse, a doctor, pharmacist, dietitian, medical laboratory scientist, and all other healthcare professionals. I also talk about study abroad routes. I have a personal guidance where I can teach and guide you how to gather your documents and apply for admissions, apply for your qualification to be recognized in different fields. If you want any of my service, send me an email, which you're going to see in the link down below. I also link some of useful videos you might want to think of in my link. Subscribe to my channel and let's continue the video. Another question could be, what are the skills that you have that will continue to help you in your profession or in your career? Now, this is a tough question. If you don't take some time to think, you might not be able to answer accurately. Now, it all depends on who you are. Time management skills is something that can help you because it helps you get things done accordingly. Ability to prioritize needs, triaging, is a skill that can help you in your career. Professional growth, personal growth, good communication skills. These are things that could help you grow professionally in your career. So you might want to mention that, explain a little bit of it, and then give example of how you think these skills that you have can also lead you to a higher rank in your career. Now, another question is, do you know that HIQA? Do you know what HIQA and the standards required by a nursing home? So HIQA is like a board that takes care of that. They kind of make rules and regulation how the elderly should be taken care of. If you work in the nursing home, they have when they go for accreditations, they make sure the nursing home is putting all these things in place to protect the elderly. So I may not be able to give you everything about this. You might want to go online and type hiqa.ie, HIQA.ie, and then you would see the website and just go through so that you have an idea in case you have a question like that, But literally what they do is they put rules and regulations to protect the elderly. And it's very important that every nursing home have HIQA accreditation or HIQA approval. What would you do if you saw a colleague insulting a patient? What will you do? Now, this question is very critical. And like I always said, think twice before you answer. Take a deep breath. Allow the question to land so that your self-confidence comes in. Be bold. Look to them eyeball to eyeball. Smile. Maintain eye contact when you're doing any interview. Now, what will you do if you see your colleague insulting a patient? Now, in that case, usually you cannot go and start shouting at your colleague because he or she insulted a patient or a service user or a client. No. It depends on the situation. So, like, remember our STAR technique in part 1 of this video. Remember our STAR technique. You want to set a scenario that you'll be able to use. Now, let's say you walk into a colleague of yours insulting a patient. It depends. If it was violent, then you might want to interfere on your own if you've weighed yourself and you'll be able to interfere. Otherwise, you could call for help. You could also try to distract them by saying, "Hello, can I help here?" And you now talk to the patient. "Hello, my name is Ndwe, so I'm one of the nurses here. Please, can I help you? What's the problem?" That will mediate what your colleague is talking to the person. You could also leave to get the security if they were like physical fights. If it was just words of mouth, you can talk to your colleague, "Excuse me there, Mary, can I have you for a moment, please?" And you're bringing out the person in that situation, and maybe as you're going out, you could speak to your manager and things like this. You may need to fill incident form. Remember, you always say follow your hospital policy, because there are hospital policies to all of these things. So you want to follow the policy of your hospital. Don't forget to mention that. What would you do if you're seeing your patient fall from the bed? Fall is something that is taken very seriously here. They don't joke with it, because they have a lot of elderly populations that are liable or at risk of fall. That's why they have a tool that is called FRAT, Fall Risk Assessment Tool. Every hospital has a way they assess falls. So when a patient is assessed with this tool, so if you they will not know how you manage this patient. Some of them will have to go with a wristband. There is like a sign on the door to know that this person is at risk as fall, so that if ever you hear anything prang in that room, you have to rush and be there. So let's say you rush and a patient fall from the bed. There are 2 types of fall. It could be a witness and unwitnessed fall. If it is a witness fall, then you have seen how the patient fell. Did he hit the head? Did he hit in the hip? Did he break any bone? You would know if there is any much of impact with that fall. And there's also a guideline for every hospital how you manage that. So if it is a witness fall, you still have to fill the incident form, but you may be able to help the person there, to just get up, get maybe like a hoist, get some of the lifting equipment to get the person called for help. The alarm is always there. You press, somebody will come and help you. If it is an unwitnessed fall, you also want to emphasize on the fact that you did not witness it. So you call the person, "Hello, are you okay? Can you tell me your name?" After which, what is it called? Something assessment is done. Neurovascular assessment is always done at every fall, so that you check if the patient, if there's any altered confusion, any new mental health duration and stuff like that. So if it is witnessed, you need to put it that it's witnessed, and you can start helping the patient, or you call for help. If it is an unwitnessed falls, then that one you need to treat as if it is very dangerous. The doctor needs to know, the note updated. Don't forget to mention all of those points. What will you do if a patient refused medication? Now, like I said in the other video, if you go to NMBI, there is like a 2 or 3 page document for patient refusing medication. First thing you need to know is that a patient is an adult. If it is an adult, now they have the authority to make decisions for themselves, except they are deemed unfit to make decisions for themselves. That is when you can then look for alternative sources to make you make decision, or somebody that is making decision on behalf of that patient. But let's work with somebody who is very fit to make decision and mentally okay to make decision. So you come and give me medication, so take paracetamol. How this is to help you with the pain? And I said, no, I am in pain, but I don't want to take it. The next thing you want to know is to explain what I stand to lose, or the adverse effect of my action. If you do not take this paracetamol, your pain is going to increase, and when your pain is increased, it might start making your blood pressure to go up because you're in pains, your things like that, depending on the condition of that patient. Now, if it was something like maybe medications to help a person sleep, and the person is always unable to sleep, you could say, okay, if you don't take this medication, you won't be able to sleep, and because you're not able to sleep and rest well, your blood pressure will be going up, and this is not good for you. You need to explain why the person should take that medication. If the patient still refused, then you need to update the person's record. Write on the chart that patient refused. Write the actions you have done. Report to your manager. Report to the managing team. Update the patient's chart. Do not just move and go, because remember, anything that you did not document, you did not do. So those are the steps you take if a patient refuses a medication. You are going to say that to them as well. Now, if you're asked anything, is there anything you would like to add? Anything you would like to ask us? Now here, this is my opinion. Different people have different opinions. In fact, if you even go on Google and type, what questions can I ask my interviewer? You are going to get different questions. For me, I am more interested in them knowing the fact that I know what I'm doing. I truly need this job. So if I was asked this question, this is what I'm going to answer. Have I been able to answer all your questions? Is there anything you would like me to clarify? What is the next step after this interview? I have looked through your website, your goals, your objectives, what you stand for aligns with what I feel professionally, which is why I'm really interested in working with your firm, with your hospital, with your institution. Is there anything you think I should clarify or that will make you not to select me after this? These are the questions I will ask them. What is the next step? And for instance, if you are very okay with the interview, what you've given them is what they are asking for, they will tell you something that you are sure that it sounds it sounds assuring that you're definitely passing through the next level. How will you adapt to working in older persons / residential services, especially if you have not had the experience before? Questions like this, you need to be very tactical on how you respond to it. Now, let's say you've not worked in any elderly person's home. You could start by giving your personal experience. Most of us were lucky enough to be giving birth to see our grandparents, our great-grandparents. We have already taken care of elderly people in our family. So even when you have not done it professionally within the walls of an organized institution like hospital or nursing home, you have had the experience of taking care of an elderly at home. So if you ask this person, how will you adapt? You could start by saying something like, you love taking care of the elderly. You've taken care of your grandparents, you've taken care of your mother-in-law or your parent-in-laws. You know that it's slightly different, but they are human beings, and you are going to follow all the rules and regulations that is being set out to protect the elderly, to protect you as a staff taking care of them. You're going to follow all policies and procedures. You're going to ask questions where you do not know. You're going to continuously attend continuous professional development programs. You're going to continue taking online courses to improve your knowledge on how to take care of the elderly. That is how I will approach questions like this. You could also have questions like, explain how you work as a team leader. So if maybe the position is, it may not be as a team leader, or maybe just as a team, because teamwork is something everybody should have. Now, like I said, remember our STAR technique. So teamwork, you've worked in a hospital where you have different people before. So you want to tell them that working as a team is something that is very profitable for the patient, and it makes patients or service, you rendering the service to patients very easy. Now, let's say that most times you have to work with other people. You have to work with a multidisciplinary team. You have to work with some of your nurses. With this, You have to constantly communicate with them, avoid conflict. If any conflict comes up, you solve it as soon as it happens. Things like this help you work well as a team. Do you know what it means to work within your scope of practice? Very, very important. What does it mean to work? What it means to work within your scope of practice is that as a nurse, you have your jobs, you have your roles and responsibilities. That is what you stick to. Also, working within your scope means doing only those things you are certified to do. I've mentioned it previously. If you were taking blood samples from your hospital back home and you have come here, you have not undergone the process of cannulation training or how to phlebotomy training, please do not go and start taking bloods. That's not how you work. You are working outside your scope. So your scope include the things that you have been certified to do. Your job as a nurse, don't go and start doing the doctor's job because you know how to do them. The ones that you have been certified to do, so those are the things you work within your scope. If you are in charge of the ward on the day and 2 staff call in sick, how do you manage the day? Being in charge of a shift does not necessarily mean you are the nurse manager. It just means that you are the most senior person for the day and 2 other people calling sick. What will you do? First thing is to try to work with the person that is already there. Work with the people there, prioritize the need of the patient, arrange the patient's the duties that is supposed to be done that day according to priorities. Do the ones that are important first. Call on your nurse manager, call on the people, the clinical site managers who are in charge of, like back home, we used to call them compound nurses. The compound nurses are the same people that they call clinical site managers here, because they do the work out of working hours job. So you could call on them. That back home, if you have such situation, you call on the compound nurses. The compound nurses are the one that takes charge of the entire hospital. They can go to other wards to pull nurses who are not so busy to come and help you. They could look for ways to come and help in the ward themselves. They could also call in agency nurses, like here, agency nurses to come and help. So those are the steps you're going to do, and then you try to prioritize your need. Explain to some patient that you can explain. Those patients that can take care of themselves, those patients that can give themselves a bath without supervision, they can go ahead and do it. And those ones that cannot do it, please do not allow them to do it. Tell them to wait till you come for them, that you are trying to be as fast as you can because you are short staff. If you have watched this video to this very period, please let me know if you still need more of these kinds of video in the comments, and I'll continue them. Kindly subscribe to my YouTube channel, and I will see you in my next video. Thank you.